This is absolutely one of my favorite topics ever when we're talking about thyroid medication, and that is T3. So Cytomel, liothyronine, however you want to call it and term it, it's awesome because T3 is your active thyroid hormone. We have talked about this at length, so please feel free to go back and watch any of my videos and Facebook Lives from the past few weeks. I'm diving deep into one topic every single week just to support you and give you a lot of great information so you can be an advocate for your own body and your health. So when it comes to thyroid medication, we have to, again, consider you as a whole person, look at all of your labs, complete lab panel. So this is going to be a game changer for you, and you can probably hear the excitement in my voice. The latest introduction, the latest member of the family to the Fixxr line is Metabolism Fixxr. And this, oh my God, I formulated this just for all my people out there that need to lose weight, that need help in the weight loss department, that can't lose weight no matter what they do, that feel like they have a slow metabolism, and that might be thinking of trying all those peptides out there, you know, the Beverly Hills soccer mom drug of choice for weight loss peptides. Or even if you're on them already and you're like, man, these are really expensive and I'm still not losing weight, add in Metabolism Fixxr. Here's what I did. I took the power of T2, which increases your basal metabolic rate while you are sitting there watching Netflix. You're burning fat while you're watching Netflix. I combined it with a very unique patented ingredient called Suppressa. Suppressa has multiple clinical trials backing its efficacy in reducing your appetite, decreasing snacking, and providing way more control over your food intake. It is amazing. We also see improved emotional well-being, just decreased food cravings all around, reduced hunger, and weight management. Add on top of that, we have green tea extract, we have purple forest purple tea extract, both of which affect the metabolism in a very positive way without the jitters of normal fat burning supplements out there from the 1980s and 90s, right? The ones that made you feel like you're having a heart attack. You will not have that in any of my supplements, Thyroid Fixxr or Metabolism Fixxr. But Metabolism Fixxr, ooh, yeah, we kicked it up a notch. It is in powder form, so you can drink it through your day. It's going to flavor your water. We got orange crush and refreshing citrus. I love them both. It is going to keep you under control all day long. So you throw a couple scoops in your water bottle in the morning, throw a scoop or two in your water bottle throughout the day. You will have fat burning and appetite control the entire day for what? An eighth of a price of the peptides? Oh my God, you can't go wrong. So grab some Metabolism Fixxr today. Please let me know how you do on it. I am super excited for you. Super excited. We went into all the different labs over the last couple of weeks with TSH, free T4, free T3, and reverse T3. And of course, the thyroid antibodies as well. So we take all of that into consideration, and then we look at you as a whole person. So we ask, what are you still dealing with? What symptoms do you still have? So let's put that all together in a nice little bundle and then decide what medication is right for you. Many, many times I find that patients do well and thrive and get their lives back with T3. So whether that is Cytomel added into Synthroid, so we'll just add a little bit of Cytomel into your regular dose of Synthroid that you're probably already on, since Synthroid is the most prescribed medication. So a little bit of Cytomel butted up with Synthroid makes a really nice T4, T3 combination. And that little bit of T3 can do wonders in your body, since that's the active thyroid hormone. The other option is if you are on an NDT, which we went over also this week, natural desiccated thyroid, that's an 80-20 split of T4 and T3, we can add in a little bit of Cytomel to that, just boosting up the amount of T3 that your body gets. Let's make your cells happy. Your cells have the receptor sites on them for T3. They do not have receptor sites on them for T4. let's make your cells happy and give them a little bit of T3. The third option is for people who are non-converters, but I personally am a non-converter, and I'm seeing more of my patients come up as non-converters as well, whether there's a high reverse T3 or whether that person just simply does worse and experiences hypothyroid symptoms when we add in T4 or increase their dose of T4, which is Thyroid or levothyroxine. So let's keep that in mind. So non-converters need T3 only therapy, and this does wonders. And then the dosing is where we just work together, and we work with your body, and we work with your lab values as well as your symptoms, and we piece that all together. So many people need T3 only therapy because when you give them T4, they get worse. So you would think more medication, better, not necessarily true. Sometimes when you actually increase the dose of Synthroid, a person will experiencing more hypothyroid symptoms. So again, Cytomel, liothyronine. Cytomel is the brand name. Liothyronine is the generic. It's T3. It's what your cells want. Hashimoto's patients do better with a little bit of T3 added in. And we can easily increase the percentage in patients that are on NDT. And then just remember, you might be a non-converter and need T3 only therapy as well. This is what I do with patients. Once again, I work one-on-one, we dive deep, and we figure out exactly what is going to work for you. Medications are like Cinderella's glass slipper, and we're going to continue using this analogy because it has to fit you perfectly, and it has to take down your symptoms, give you your life back, and make you feel great. It completely is possible. I promise you. I do this every day with my patients. Visit my website at amiehornaman.com because there you will find a free guide, a free downloadable guide that gives you all of the optimal lab value ranges for your thyroid. And that's very important when you're looking at your numbers and you're looking at the medication that you are on or that you may go on in deciding exactly what route to take and what your body needs. So let's look at and get you into the optimal lab value ranges on your labs. And then let's also get you feeling optimal as well. Thank you so much for listening to the Thyroid Fix podcast. As always, please share this with anyone that you know that needs this information. And I guarantee you there's a lot of people out there and in your life who do. If you would please take a moment to write a review on Apple Podcasts, that would be much appreciated. I read all of them. Also, please remember that anything that you hear on this podcast is not intended to diagnose or treat. So you always want to check with your doctor about any advice given that you hear on this podcast. And if you would like to book a discovery call, a free discovery call, to go over everything that's going on with you and to go over how I can help you, please go to my website at amiehornaman.com. The link is always in the show notes. And click on book a call. Choose a time and a day that's right for you. And we will see how we can help you. Thanks for listening.